How are you today? Excited to be here. Hope you all had a great weekend. I'm going to talk today about the difference between a bulging disc, herniated disc, and those who don't have a disc injury. And I'm going to go through some ideas on what to do with it, how to treat it, how to assess it, what it all means, and most interestingly, sciatica. Does it cause sciatica and whatnot? As everybody knows, I'm a chiropractor. I have about 21 years of clinical experience, multiple postgraduate degrees, all this kind of stuff. As you see, I'm wearing scrubs right now. I'm in the office virtually every day. And the number one thing that most chiropractors see is, without question, lower back. And 8 out of 10 Americans at some point have lower back injury, lower back pain. What's most interesting about that all is that if I said the word herniated disc, I'm going to pause for a second. Tell me what comes to mind. What probably comes to mind in most of the people out there, most of the patients, is the idea of surgery for a herniated disc. And that's not true. It's a very common injury. It's not something that everybody wants, but it's a common injury and one that can be treated conservatively. And a chiropractor is, without question, the point of reference and should be, if you will, the primary care approach to a bulging disc in multiple issues and with different demographics. That's right. I see Shanae say bulging out. Absolutely bulging out. We're going to go through the difference. So I've got a little disc here. And I took the little model to show everybody what's going on. So here we go. I'm going to get as close as I can. And I'm going to be looking right over here. And you see this little stuff in the middle? That's what we call the nucleus. Believe it or not, the nucleus, which everybody refers as gelatinous, is actually 80% water and 20% gel. So it's kind of not like the jelly in a jelly donut like so many people talk about. It's more like I would look at it as a thick soup or a thick milk. And that's very important when we talk about the injury. So there's the nucleus. On the outside with these concentric rings, concentric mean going circularly, you've got the annulus. You have an inner annulus, inner more towards the nucleus, and an outer annulus. The outer annulus is what's innervated by a nerve. So any of you chiropractors watching, if you want to tell me what nerve innervates the outside of the disc, I'd be curious to hear somebody say it because, it's one of those stumper questions we had back in chiropractic school. Now, behind the annulus, believe it or not, is the spinal cord on this. So we're skipping some anatomical parts, but here's the spinal cord. And on each side, I'm going to go, here's your, I'll face you. Here's your left side nerve root, and here's your right side nerve root. So you've got the spinal cord in the spinal canal, and the left side's going through what we call the neuroforamen. See, it's moving around. And the right side's going through the right side neuroforamen. So that's real basic. Now, what everybody should understand is this basic anatomy. And anytime you go to, whether it's an orthopedist, PT, a chiropractor, you want them to give you an explanation like I'm giving you now as I break down the different stages, and I want them to give you an explanation also of where you fit in the stage and how they want you to progress. It's sort of like what we call a report of findings. So that's the basic idea. And if we go behind here, you may see it right here. There's a little hole. There's a little line. That little line is what we call the joint or facet. And that's what chiropractors, as you see, I'm moving a little bit. That's what we try and adjust. We try and manipulate the facet joints. This guy in the back, it's kind of big. It looks like the tail. It's your spinous process. So once again, that is a perfectly healthy disc. The nucleus is in the center. Now, the property of the nucleus is to actually dispense with force, so it's cushiony. Now, what the disc doesn't like, it doesn't like forward flexion. It doesn't like when you bend forward because it pulls on these concentric rings. And when you pull on these concentric rings, that's when you can damage the annulus material and the centerpiece, this nucleus, can come forward. So some of the things before we go any further, if you want to avoid a bulging and a herniated disc, you want to avoid a lot of forward flexion. So you don't want to bend, if this is your spine, at the lumbar spine. You want to move at your hips, and we call that a hip hinge. Most people bend on their lumbar spine. I'm going to show you. When you stand up, I'm going to stand. You see me bending at my lumbar spine. I'm rounding my lumbar spine. That damages my back. Right here's my hip. If I were to push my hip bone back, if you will, and bend at my hip, you would see a perfect movement. I would not injure my lumbar spine. Typically, people who injure their lumbar spine, it comes from some form of trauma, whether it's cumulative over a duration of time, like bending forward wrong several times a day, or initial trauma like a car accident, a rugby, a football injury, deadlifting, something of that nature. So you kind of want to avoid that. You get 28,000 flexions, sounds like a lot, in your lifetime before the average person damages their disc. That's essentially just enough to tie your shoelaces wrong every day by the time you're 40 years old. So now let's take the next step. And I'm going to go down. I see some people talking to me, so I want to answer them. If you have any questions, go for it. So what if the bulging disc leaks out? Hey, Sinead, we're getting right there. Touching the toes is no good. Touching the toes is good as long as you're using it in a hip hinge. Always behind up, correct. Always actually butt back and then up. So let's take a look at this and you can see the difference in here. So what you see is a little bulging out of the nuclear material. It's still encased in the annulus. This is what we call a bulging disc. So many people have this. This can cause some discomfort. This always doesn't cause discomfort. Bulging disc is sort of like the girl with the curls. Some people like it, some people don't. So that bulge, as you can see right over here, is pushing out. There is a little deformation of the annulus material. Having said all that, it's typically just like this, posterior going to the back, because this is the front part, and lateral to the side. That's the most common type of disorganization of the disc material. Now, having said all that, obviously we want to avoid this. Now, the bulge, good outcomes with the bulging disc. Many people have it. It's rare, I'll say, that people have to have any kind of surgical intervention. Now, if you have a bulging disc and you still have a lot of pain, you may want to reconsider your treatment plan. Feel free. What I'm going to do for today is I'm going to give a free 15-minute consultation on the phone for anybody that has a damaged disc. I'm very, very happy to go over it with everybody. It's the summertime. We're into COVID-19. And I want to talk about anybody that has a bulging disc. Just, feel free to reach out. We're going to have a conversation with you. So that's the bulge. It's obviously not the same as this, as we put them both up together, as you can see. Now let's get to the herniated disc. This is where, if you will, the rubber hits the road. The disc is herniated. It's torn through the outer annulus. The bulge, if you see right over here, is the inner annulus. The herniation is torn towards the outer annulus, and sometimes the material is actually outside the confines, like here. I'm going to try and come here, outside the confines of the disc material. So now you've got this material, and this material can, in theory, press on a nerve. I'm going to give you a takeaway here. We've used this expression multiple times on, and I'm just going to look at my questions. I'm in a room all by myself. I'm going to tell you that everybody says it applies pressure to the disc material. Here is your takeaway. Here's your clinical gem for the day. It's typically not pressing on the nerve, because if it was pressing on the nerve, it would be one of the nerve roots in the sciatic nerve. Your pain would be incredible. It's more so that it's leaking and there's a chemical irritant to the nerve. Having covered that, now you understand that it is an inflammatory process, and this disc material is inflaming the nerve. Now, why is that happening? Let's take it one notch above. Let's take a look at this. And this is what all the doctors and practitioners should be explaining to you. The fact that it's irritating and leaking on the nerve. The body is not used to disc material being outside the confine. The body's got an immune system The immune system has what we call two push buttons, self and foreign, meaning is this disc material self outside the confines of the annulus? The answer is no. So it's foreign material. The body processes and looks at the foreign material of the disc outside the disc material, and it turns on inflammatory processes. When it turns on these inflammatory processes, this area, this local area, really speaks to the idea of inflammation. Ultimately, if it's there for a longer period of time, what would happen? You would have systemic inflammation. So when you look at osteoarthritis, for instance, osteoarthritis is not wear and tear. Osteoarthritis is the body's response to inflammation or the inability to manage and modulate inflammation. So with this disc material coming outside this herniation, there are some instances, not many, say that again, not many, that require surgical intervention. If you look at the stats and you look at a lot of the data, spinal surgery is not having positive outcomes. So I don't recommend it in most instances. I got another one. Dave D'Angelo, how are you, my good friend Dave? What supplements would you recommend? We are just about ready to get there. I'm going to share some thunder with you because I know you know them all, having been years in the spending years in the functional medicine business. So the key takeaway, I want to reiterate it one more time, is very simply that when you have a herniated disc, this disc material, it can be bothering and irritating, if you will, the spinal cord and the spinal nerves. Sciatica, largest nerve in the body. True sciatica is lower back pain, pain going down your lower back, through your buttocks, down the side, because sciatica should be sciatica, down your side into your big toe. Now, having mentioned that, and if you don't have that very unique distribution of nerve pain, doesn't mean you don't have a nerve problem. It just doesn't mean you have true sciatica. Now, when you take a look at this herniated disc, you also have what we call at the bottom here where my hand is, called your glutes. And inside your glutes, I'm going to go outside, is a muscle that looks like this, called the piriformis. Piriformis irritation or tightness can cause piriformis syndrome because the sciatic nerve is in close proximity to the piriformis. When the piriformis gets tight, you have something that is pseudo or fake sciatica, if you will. True sciatica is truly unbearable. So you're probably getting a nerve root irritation from the chemical irritants. Now, I just got a whole bunch of people said, I never knew it was a chemical irritant. I thought it was direct pressure. It's a chemical irritant making an inflammatory microenvironment. So let's just go through this again. Here's your disc material. Perfect nucleus. Perfect annulus. Here's your bulging disc. Now, mind you, I'm touching it. No way, this is hard. The model doesn't have the right texture. Remember, I can't barely touch that. That nucleus is really not even gelatinous. It's sort of like a cold milk. And here is your herniated disc. So some people say when the material comes out, can it go back in? It's not that easy. It's kind of difficult. So having covered all that, a lot of questions would be, well, what do you do? How do you treat it? What would you do? Well, the first thing is you would get a great assessment. Have the doctor take a look. Have the doctor, of course, I'm biased to doctors of chiropractic and myself. Once again, if you want that 15-minute consultation, we can do it by the phone. I can answer a whole bunch of your questions. Get a good assessment. See, is it a nerve irritation? Is it a nerve entrapment? What's going on? Why did it occur? What is it that's occurring? Are you bending on the lumbar spine? Are you lifting something wrong? Are you sitting too long? Are you a truck driver or an Uber driver and you're sitting in vibration? Because seated puts the most pressure on your disc. Seated compresses your disc, puts the most pressure on your disc. Your disc doesn't like vibration. When you drive, there's vibration. It doesn't like bending. So standing is the best thing. So, the old idea on rest for lower back pain, antiquated, not the case. Active, strengthen your core. That'll be one of the things. So David asked a question on supplements. I want to go right to the supplements, and I want to help you share some insight to you. As you guys know, I have 6 postgraduate degrees in nutrition, so I do a lot of supplementation. So the first supplementation, if you will, is change people's diets. I'm a big proponent of anti-inflammatory foods. The idea of food being a potentiator for inflammation, bad foods, processed foods, high sugar foods, gluten, and dairy are very damaging to people's overall health, and they can actually attach to the specific injured area and cause an inflammatory status. So no sugar, no fried foods, no gluten, no dairy. Try and keep your grain consumption down. Ancient grains are fine, but try and keep your grain consumption down. Eat more whole foods, fruits and vegetables. So that's the food. The supplements that I recommend would be, in not any order, but let's talk about them. Turmeric. Turmeric is a beautiful herb. Turmeric is shown to block NF-kappa B, an inflammatory pathway that leads you down the path of a cytokine storm. So turmeric has the ingredient curcumin that gives it that orangey look. It's very traditionally used. You can put turmeric in a supplement. You can put it in your coffee if you like. You can put it in different aqueous solutions. So turmeric's a great choice. Boswellian ginger, typically go with that as complementary, supplementary things that enable you to decrease inflammation. Omega-3 fish oils are a great choice. 4 to 6 grams in an article in December of 2019, spoke to the idea of really helping the disc material. Vitamin D, I think it was 2.3 times the increased incidence of lower back pain when you were deficient in vitamin D3 with K2, 5 to 10,000 IUs. Here's an interesting takeaway. Glucosamine, HCl, and chondroitin sulfate. The literature really dictated in 2003 in an objective study, the testing that was done by MRI, which is clearly objective, showed that glucosamine, HCl, and chondroitin sulfate actually let the disc be rehydrated. Great choice. Hyaluronic acid is something that you may want to add. Hyaluronic acid actually decreases as you age, but it allows for the slippery surface in the joints so they don't rub and you get the inflammatory status. Maybe the biggest takeaway, pro-resolving mediators. Pro-resolving mediators are a great choice because they allow for the resolution of inflammation. A lot of good information coming out on that now with the COVID-19. And that's just a broad overview. There's a multitude of other supplements that we could get into detail. Obviously, I'm a big guy on the gut, big proponent that as long as you have good, strong, pristine gut health, you're going to have a decrease in inflammation through the body, and the immune system's going to work at a high functioning level. Some other things that I would recommend, let's talk some chiropractic treatment. Big shout out to my friends at Arconia, the Arconia laser. So the 635 nanometer laser, we just did a Facebook Live on it, has gotten an FDA clearance for chronic lower back pain, 8 visits in 4 weeks. Really, the outcomes were stellar. In addition, we now have what we call an FX405. So the FX405 has the red 635 light, and 405 is the violet light. They've studied blood tests and found out that people who have a higher incidence of lower back pain have something elevated called interleukin 6, which is a key component to the cytokine storm, and interleukin 8. The violet 405 light helps ameliorate the levels of interleukin 6, and the red light helps ameliorate the levels of interleukin 8, so that FX405 is now going to be the new player. Flexion, distraction, decompression has shown to open up the lumbar spine. By opening up the lumbar spine, you're getting movement in the joints, and you're getting nutrition, natural nutrition, from a process called imbibition. Shocking as this may seem to many people, chiropractic adjustment, great studies shown on lumbar injuries to have an aid in outcomes, speed up outcomes. Nobody does adjustments better than your certified chiropractic physicians, chiropractors, doctors of chiropractic. Let's also talk about some exercise rehab. The exercise rehab that we look at is core core activation. So for me, I always adhere to what I call, to me, the forerunner in core activation, and the guy who knows more about core than anybody I've seen before would be Dr. Stuart McGill. Big shout out to him. He's from Canada, and he talks about bracing the lumbar spine, a 360-degree co-contraction around the lumbar spine. Great option. Hold your core, get your own natural corset together. So once you learn how to brace and hold it together like my hands, my suggestion is to do specific exercise that will enable you to hold your core in a subconscious manner, hold your corset tight. That would be a front plank, a proper side plank, bird dogs. If you need any exercises, my recommendation, big shout out to my good friend Dave Cruz at Web Exercises. Without question, nobody has a larger list or a litany of exercises that you can access. So I do prefer to use Web Exercises. Chiro Up also does a great choice. Gave all my shout outs. So when you come into somebody like a practitioner like me, first of all, woman came in on Friday and she was upset. She was in a lot of pain. And I let her know, I'm here to help. I'm fully engaged. She calmed down a little bit. I understood that she was in pain. So I had the empathy and sympathy. I've had lower back pain before. I've seen patients with lower back pain before. It's what I do every day. Remember, I ask everybody, who can you trust? Trust me. I care. I want to make a difference. I want to help you with your lower back. So getting back to the patient, we were able to bring down her pain. We did many of these treatments. We worked with her. We laid out a plan. We made lifestyle changes. We made food changes. We gave her supplements to help. We actually gave her some supplements pointed at decreasing nerve pain. And I guess I should share that with you. With the nerve pain, it would be alpha-lipoic acid and PEA. You could also, instead of the PEA is great, you could do gamma-linolenic acid and always give your omega-3 fish oils. That would be a great protocol for sciatica. In the future, I just got somebody who reached out. They wanted me to do some nerve flossing, so I will go through some nerve flossing and show you how to floss the nerve and ascertain the nerve. I can't do it right here all by myself. So what I'd like to do for the next minute or two is I'm going to address some of Shanae's questions. If you guys have any other questions, I'd love to answer them. So Shanae said her husband Durkee's leg goes numb from that bulging and the nerves pinching. Well, Shanae, here's what we need to do. We need to get him in. We need to work on him. I understand we need to break down the wall that he has to go to the doctor. Let's see what's going on. Let's help him at his lower spine level. Remember, he who treats the side of pain is lost. Let's figure out why and where his pain is coming from. Dave D'Angelo, once again, how would you recommend pain and pinched nerve and bulging disc? We got that. Eva, how are you? Would you use inflammation setting on the EVRL to treat bulging disc over the area? Yes, I would. I would love those settings. I would love the mixture of the EVRL. We talked about the FX405. The EVRL is a handheld version. Great choice. The inflammation would be excellent. Shanae, you have to get back in. I agree. I agree with you, Shanae. Yes. Plank, front plank, proper side planks are a great choice. How to do a front plank, well, or how to do a side plank, we will have somebody get you a picture of that. Let me go back up and see any other questions. We got a lot of chatter today. I love it. Somebody else asked me, do you combine treatments? What I just gave you is my treatment. After 21 years and having the opportunity to lecture to people, get their information in a situation where a lot of the great docs listened to my lecture and shared with me, and also sitting with a lot of people and hearing them lecture at different symposiums. I've gotten that information. That's why I've synthesized this into a treatment protocol. So we're going to try and get back on tomorrow at 1 o'clock, 1:30. We'll see what we can do, probably a little closer to 1:30. You guys have been great. Any questions, please share it. Comment. I'll answer your question later. Do me a favor, I forgot to ask you. Can you please share this? This is incredibly vital information. Everybody you know at some point has had some form of lower back pain, and everybody, when they hear the idea of herniated disc, they throw the towel in. It's not over. It's not a surgical sentence. You just need to find somebody who understands the mechanism, the anatomy, and can explain it to you. A couple of quick factoids before I leave. 1/3 of Americans walk around with a herniated disc without pain. So don't let pain be your true determinant. Everybody have a great day. Dr. Rob, always yours in health.